Hello, everyone. My name is Nathan Conover from Nexus Youth and Family Services. And for this month, our wellness workshop is going to focus on coping with anxiety. Anxiety is something that so many of us deal with on a regular basis. And, dealing with the COVID pandemic has definitely increased anxiety across the board. So today, kind of just want to take a look at what is anxiety, where does it come from, what does it look like, and how we can deal with it, and hopefully we can lower it. So first, in our discussion of anxiety, we need to get on the same page and define anxiety so that we know exactly what it is that we are talking about. So for purposes of discussion today, we're going to define anxiety as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Okay, so this is just a very general, very broad definition of anxiety that we're going to use just for the purposes of our discussion today. We are going to get into the weeds a little bit in some very specific types of anxiety because there's a lot of different avenues that anxiety can take. But just so that we can be on the same page about what we mean when we talk about just anxiety in general, very common, low level, very broad anxiety, this is the definition that we'll use. Now that we have defined anxiety from a 1,000-foot view, it's important to recognize the physical effects of anxiety because anxiety is not all in the head, it is also in the body. So anxiety produces physical changes in the body, such as an increase in heart rate, sweating, tightening up of muscles, twitching, tremors, etc. And then some more specific effects would be shaky voice, sweaty hands, butterflies in your stomach, you know that feeling, dry mouth, difficulty holding your hands steady, and also difficulty concentrating. So again, these are kind of just all the general effects of anxiety on the body. Not everybody experiences all of these anytime anxiety takes place. But I'm sure pretty much anyone watching this would agree that if you've ever experienced anxiety, which if you're human, you probably have, you've probably experienced at least one or two of these sensations. A lot of us deal and experience anxiety in different ways. So whereas one person might get sweaty hands when they're anxious, another person might experience sweating on the forehead, and maybe the two don't overlap between two different people. These are just some of the very general effects of anxiety. And in a minute, we'll be able to look at some very specific anxieties. So one of the specific anxiety disorders that I want to make sure we cover today is separation anxiety disorder. So like I was saying before, there's a lot of different kinds of anxiety. And anxiety is a general term that everybody experiences, but there's also clinical anxiety. And so if you look in the Diagnostic and Statistical Manual of Mental Health Disorders, the DSM for short, that is what therapists, psychologists use to be able to give mental health diagnoses, we'll find a variety of anxiety disorders. And so when someone says, oh, I have anxiety, that doesn't always mean that they have a diagnosed anxiety disorder. Okay, so I just want to be able to differentiate between run-of-the-mill, general, common anxiety and anxiety disorders because there's a really, really big difference. Anxiety disorders are very specific. There's very specific criteria that has to be met in order for someone to be diagnosed. So I want to be able to just differentiate that a little bit. So with separation anxiety, it's an experience of an excessive distress in anticipation of being separated from a primary attachment. Okay, so when you think of separation anxiety, you generally think about a child and their guardian, just not wanting to be apart from their guardian. So they experience excessive distress about the primary attachment figures being lost due to injury, illness, or death. So if there's ever a child who is overly anxious about their mother or father dying, even though there hasn't been any kind of true risk before that, separation anxiety could be in that form. It is the most common mental health disorder in children under the age of 12. At a whopping 4% of all children experience this clinically. But again, it must fit the diagnostic criteria from the DSM-5. Another classification of anxiety disorders, again, in the DSM-5 is specific phobia. So again, kind of like the word anxiety, this is a word, phobia, that can be thrown around a lot without having actual knowledge about what it takes to be diagnosed with this disorder. So a true phobia is a marked fear or anxiety about a specific object or situation. So some of the most common ones that we all know about would be fear of flying, fear of heights, fear of spiders, seeing blood, all that kind of stuff. The phobic object or situation almost always provokes immediate fear or anxiety, and the phobic object or situation is actively avoided or endured with intense fear or anxiety. And so 7 to 9% of people in the US experiences this, which is very, very high. Now we can move on to generalized anxiety disorder. So this is one of the most common, if not the most common, mental health disorders in the world. And so when people say, oh, I have anxiety, a lot of the time this is what they think of. It is often incorrectly self-diagnosed, but if it is diagnosed by a therapist or a psychologist, very, very treatable. So some of the diagnostic criteria, so this isn't all of the diagnostic criteria, I didn't have time to do that, but if you want to look at the full diagnostic criteria, you can totally Google it. It's very easily accessible, but it is persistent, excessive, or unreasonable worry or anxiety accompanied by a variety of physical and cognitive symptoms. It must be present for at least 6 months to be considered for clinical diagnosis. Some of those symptoms would be restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbance, on and on it goes. Social anxiety disorder is similar to generalized anxiety, but it is very specific to social situations. So there's an intense fear and anxiety about social situations, fear of being negatively evaluated or judged by people, fear of offending others or of being offended, being rejected by others. And the social situations frequently evoke fear, so an individual who becomes anxious only occasionally in situations would not be diagnosed. So if you're the type of person who is still able to go to the store or go to a party, and you might be a little bit more introverted, but you're not genuinely scared, that's not social anxiety disorder. You might just have a little bit of social anxiety. So it can be kind of hard to tell the difference, but generally we can tell because of the duration. If you've been feeling this way for a really long time, like number of years, number of months, and then also the severity. How severe is it? Can you not go outside at all? That could be social anxiety or agoraphobia. Another one would be panic disorder. So a lot of the time I hear terms like anxiety attack or panic attack really thrown around a lot, like a lot of the terms that I mentioned before. They've really kind of become a part of the common vernacular or common speak that we talk about. without actually knowing what it truly means diagnostically. So panic disorder means that you have 4 or more of one of these symptoms present in order to be diagnosed. Okay, so if you've ever had a true panic attack, all of these will ring true for you. If you've ever just had a low level of anxiety, you'll look at this list and be like, oh, mine is not that bad. I don't have panic disorder. So pounding heart, accelerated heart rate. I've heard people describe it as they felt like they were genuinely having a heart attack or their heart was about to burst out of their chest. That's how powerful it can be. Sweating, trembling, shaking, feeling of choking, chills or hot flushes, chest pain, nausea, dizziness, fear of dying. I've heard this a lot too with people who have this disorder or who've just experienced a panic attack in general, is that they genuinely felt like they were going to die. Okay, and there's an important disclaimer here that I put at the bottom that having one panic attack doesn't always mean that you have panic disorder. There can be any number of things that can induce a panic attack, whether that's some sort of trauma or some sort of really bad situation that triggers a ton of anxiety. There has to be 4 or more of these symptoms present to be diagnosed with this disorder, and then not pictured. It also has to happen over the course of a certain amount of time and a certain number of times in that span. Okay, so it's very specific, and one panic attack doesn't mean that it's always going to happen consistently. Panic disorder would mean that this is something that you're dealing with consistently. So now that we've discussed the difference between common anxiety and specific clinical mental health disorders, we can get back to talking about what gives you anxiety. You who are watching, what is it that makes you anxious? It can be so many different things. We all have our own unique stories and the way that we're wired, the things that make us brave and make us scared. So what gives you anxiety? Some of the most common things would be public speaking, being in large groups, needles, relationships, schoolwork, family health, making an athletic team, maybe it's heights, living situations, breakups, taking a test, meeting new people. The list goes on and on and on. I also want to take a minute to give you the space to be able to just process this and think about it for yourself. So with dealing with anxiety, I want you to ask yourself these questions, even if you have to pause the video just to take a second and like really think about it, critically think about it. I want you to ask yourself these questions and answer them for yourself very honestly. How do I deal with anxiety? Do I handle anxiety in a healthy way? What are some healthy ways people handle anxiety? And what are some unhealthy ways people handle anxiety? Like I said, everyone deals with anxiety in their own way. These are called coping skills. The difference between healthy coping skills and unhealthy coping skills is pretty stark. Some people might handle anxiety with drugs or alcohol, and this would obviously be an unhealthy coping skill. Some healthy coping skills we'll cover in the next slide. Now we have some specific anxiety coping skills for you guys, and these really would fall into some of the more body experiencing, being able to calm the physical experience of anxiety. So I've got 2 things for you here. The first one is called the deep breathing technique, which a lot of you probably already know about. You breathe in deeply for a count of 4, you hold for a count of 4, and then you breathe out for a count of 4. This is also called ocean breathing. This is also called square breathing. There's a lot of different ways to kind of be able to think about it. But really the idea is that when you are able to calm your heart rate, you're able to calm the mind and calm your anxiety. Because it's really not possible for your body to be elevated and calm at the same time. So by being able to bring it down slowly, the thoughts of anxiety will be able to pass. There's also progressive muscle relaxation. So in order to do that, you would just sit quietly in your chair with your back straight and feet on the floor. This also works if you were to lay flat on a bed, pretty much any position that you're just very comfortable. You would close your eyes and you would imagine yourself in a comfortable place. Slowly relax all the muscles in your body, beginning with your toes, your feet. You would work your way up your body, going through your calves, upper legs, stomach, lower back, all the way up to your forehead. And basically, you will tense and then relax, and tense and then relax. Being able to really just release that tension from your body in order to at least help with the physical effects of your anxiety. Here are some more anxiety coping skills, and they're really more general. So, for some of you, some of these skills might seem really appealing, and for some of you, they may not. I would encourage you to experiment and just try them out, see what works and what doesn't for you. Art has been shown to help a lot of people cope with anxiety, whether that's drawing or painting or even like pottery or sculpture, anything like that. Journaling has been found to be really helpful. There are certain journals that will give you prompts for what to write down, or you can just stream of consciousness, just go for it and write down your feelings and thoughts. Sunshine is really, really helpful. Get some vitamin D. Just go outside, get in the sun, and being able to be in the light has been shown to really be able to just brighten mood. Exercise also is really helpful, getting the endorphins flowing, getting the blood pumping. Talking to a friend. Relationships are really, really important for people who struggle with anxiety. Friends can be very, very comforting, very supportive. So this is always what I recommend as really a go-to. Reading a book can help someone really calm down. Watching a movie. Eating healthy foods can be really helpful. If you have a healthy body, a lot of the time the mind will follow. And then also getting a solid amount of sleep. Generally, they recommend 8 hours, but 7 to 8 is still really okay. Much less than that, and you really start to see it just takes a toll on you both physically and mentally. So sleep is a really underrated coping skill. If you are more dealing with diagnosed anxiety disorder, such as one of the disorders that I referred to previously, a lot of the time you might need a little bit of extra help in addition to the coping skills that you can utilize ongoing. And therapy and medication have really been shown to dramatically improve someone who has diagnosed clinical levels of anxiety. So some of the most common forms of therapy for anxiety disorders, the first and foremost would be cognitive behavioral therapy, which would include prolonged exposure. Prolonged exposure is mostly for phobias, but it can also be for panic and social anxieties, things like that. But cognitive behavioral therapy across the board has been proven to be very, very effective in the treatment of anxiety disorders. Really helps focus on how our thoughts and feelings influence our behavior and just kind of helps you tackle some of those patterns. Somatic therapy can be really helpful, which would include the deep breathing and progressive muscle relaxation. It involves really just helping you get in tune and mindful of the physical experience of anxiety, so being able to help you deal with that. And then art therapy has also been shown to be really helpful as well, being able to take all these thoughts and feelings that are inside you and help externalize them so that it's not all just in here. And then usually I will recommend therapy before medication, but for some people who deal with very, very high anxiety, medication is often very helpful. So two of the most common medications for people who struggle with anxiety would be SSRIs, the long form of selective serotonin reuptake inhibitors. Basically, it just helps your body basically on a chemical level. It just helps with the serotonin, which is one of the chemicals that help you relax and be happy and calm. And then also anxiolytics, if I pronounce that correctly, would be another another category of medication that helps in being able to lower anxiety. But both of these medications, or any medication for any kind of mental health disorder, definitely go to your doctor, go to a psychiatrist, and really just talk through this with them, because they are the experts. They went to school for it. They know way, way more than any of us would ever know about any of these medications. And so really make sure, if this is something that you want to do, to walk through it with them so that you know exactly what you're doing. Here are some extra resources for you guys. The first one would be just a YouTube video from Dr. Jen Gunter. The title of the video is called "What's Normal Anxiety and What's an Anxiety Disorder?" So this was kind of a TED Talk that she did that she later, really expounded upon. So it really kind of goes beyond even what I was able to cover in this video, so definitely check that out. I think I've recommended it before, but I really can't recommend it enough. It's called the Sisu app. It's an app that you can get on your phone that has a bunch of different exercises, and it does a really good job of guiding you through some anxiety exercises. So if you have an iPhone, definitely go check that out. There's also something called the Anti-Anxiety Notebook, and this is available. If you just Google it, it'll pop up on a bunch of different online stores, but it's really cool. It's a journal with some guided prompts. Journaling, as I talked about, can be very helpful for anxiety, and this notebook gives you a bunch of different prompts for either drawing or writing down thoughts, and it's based in evidence-based practice, so it's really good. And then lastly, for kids, it's called A Little Spot of Anxiety. So there's a whole book series, this Little Spot book series. It tackles all these different emotions and feelings and circumstances. And so the Little Spot of Anxiety, it's a specific book by Diane Alber. Really, really good for kids, really age appropriate, developmentally appropriate, really helpful for kids in the elementary school age group. And that is all I have for you guys for today. Thank you so much for watching. Again, my name is Nathan Conover, MFT trainee at Nexus Youth and Family Services. Our general Nexus number is listed right there in case you want to use us as a resource. We have all sorts of programs here for kids, teens, and families if you need any help. And remember to like and subscribe to our YouTube channel. Thank you very much.